Dr. Helena Rosengren challenges conventional wisdom about skin cancer treatments in this brilliant and provocative talk from the Speaker Salon Showcase. Through compelling patient stories and surprising research, she empowers us to take control of our health by understanding personal risk factors and exploring practical alternatives. Prepare to have your assumptions challenged in this eye-opening Big Talk.
Jill, a 24-year-old young lady, came to see me a while back. She'd been motivated to do so because her mother had recently been diagnosed with an early melanoma. So I did the usual head-to-toe skin check, and I did find a suspicious mole right here on a décolletage. An excision confirmed it to also be an early melanoma. And according to the standard process, she went on to have a second excision to avoid a recurrence. Now, a second excision means cutting more widely and deeply around the original scar, down through skin and fat to the underlying muscle layer, and then suturing the tissues back up layer by layer. Unfortunately, Jill developed a keloid scar. That is a scar that becomes increasingly raised and painful with time unless it's treated. So she went on to have a series of steroid injections followed by microneedling, which improved, but it did not resolve her cosmetic outcome. And 10 years later, she is still conscious about the clothes that she wears to help cover that scar. She's also really worried about developing another melanoma. So she attends every 6 months for skin checks since that original diagnosis. In the 20 years that I've been working in skin cancer medicine, I have literally done thousands upon thousands of skin checks, and I've excised over 1,000 melanomas. They've been both for men and women, age 16 to 92, and they've been on almost every part of the body imaginable. At times, I've even needed to raise a nail to biopsy a suspected melanoma underneath it. On a soul level, it has felt deeply gratifying to feel I'm doing such a wonderful service for my local Australian community in finding and excising so many melanomas that might otherwise have cost lives. But in recent years, a previously unrealized truth has started to emerge that has caused me to pause and deeply reconsider the wisdom of doing skin checks at all for people at low risk of melanoma. What has become apparent is that even though the diagnosis of melanoma, and particularly early melanoma, has risen exponentially over the past 40 years, there has been no reduction in mortality, death from melanoma as a result. It's no accident that this ever-increasing rate of melanoma diagnosis in white populations across the globe coincides with the advent of the portable, user-friendly, relatively affordable dermatoscope that skin cancer specialists use. In trained hands, this pocket handheld instrument has simply revolutionized early skin cancer diagnosis. But with an increasing wealth of evidence suggesting that most early melanoma would actually never progress to life-threatening melanoma, many experts are now shaking their heads in disbelief and telling us that our intuitive assumption that excising early melanomas earlier would save lives is simply wrong. Moreover, in their 2023 Health of the Nation report, the Melanoma Institute of Australia flagged that early melanoma diagnosis, or any melanoma diagnosis, is steeped with anxiety, and that the medical profession is really bad at dealing with that, at meeting the patient and at helping them with that. Additionally, a patient may be left with a scar that can affect their choice of clothing, career, recreational activities, even relationships. Having seen a melanoma, however, as a skin cancer expert, we cannot unsee it and pretend we didn't. The real problem is that we have no way of knowing which occasional early melanoma will progress to a life-threatening melanoma. So we have no option but to follow national protocol and excise them all if they're being confirmed more widely. Currently, only the melanoma itself knows whether it's innocent or deadly, and it will behave biologically as dictated by its DNA over time. The missing part of the jigsaw may be a hitherto undiscovered biological marker that will help us identify the occasional lone wolf from the many sheep. Meanwhile, what do you do? Do you bury your head in the sand and hope for the best? Or do you go and see a skin cancer specialist for a skin check, knowing, as you do now, that any early melanoma they find may never, chances are, it will never progress beyond an innocent skin spot? There is a third choice if you are of non-Hispanic white race, and that is to hop online and access a melanoma risk assessment calculator, which will work out for you what your own personal risk of melanoma is. These tools have been validated, and we know that people find them helpful, reassuring, and they often find that their personal risk of melanoma is much lower than they had ever expected. If you are at moderate or high risk of melanoma, of course, it is sensible to go and see a skin cancer specialist, a skin cancer doctor for regular skin checks. But if you are at low risk of melanoma, doing your own naked eye self-skin examinations and only presenting to someone who's expert in this area if you are concerned about a spot is actually a safe alternative to medical skin checks. Reasons for presenting include finding a skin spot that looks really different from anything else on your body, or finding a spot that is changing in shape, size, or color, one that's becoming progressively more painful with touch, one that bleeds on toweling off, and developing a sore that fails to heal over 4 to 6 weeks should also ring alarm bells. If you are of white, non-Hispanic race, here's a resource that can help you to work out your own personal risk of melanoma. Feel free to take a photo if that's helpful. If you are of white non-Hispanic and you find that your risk of melanoma is actually lower than a few percent, then you can safely take control. by getting to know your skin and regularly taking a good look at it yourself, you will find any changing, concerning skin spot in plenty of time to get the help that you need. And if by chance you do have an early, indolent, unchanging melanoma that you miss, it won't matter. And you will be saved an unnecessary excision, expense, and worry. You can take back your power.
If you loved this big talk, I would love to hear from you in the comments what your takeaways were so I can celebrate and support you. And if you desire to take my big stage in New York City, just like these speakers, I invite you to apply to the Big Talk Academy, my 12-week signature speaker certification program. You can find all of the information that you need at thebigtalkacademy.com. And be sure to hit the subscribe and notification bell so that you are alerted to all of our upcoming videos featuring more big talks, conversations, inspiring to help you take the stages that you desire. Your voice matters, and I also appreciate you for being here. Big love. Mwah.